At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Hello, 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 and welcome to today's MedsPLUS Medical Minute. I am Dr. Jennifer. This is April, and we're still in National Minority Health Month. Dr. Pauline shared a really powerful story last week, and I would also like to share a story from a clinical consultation that we had probably a few months ago. If you have diabetes, high blood pressure, kidney disease, or you take multiple medications and have never had a comprehensive medication review, it may be time. I want to share this clinical consultation that I had with a patient. He's a 50-year-old Black male in his late 50s, diagnosed with diabetes, resistant hypertension, kidney disease. Labs were elevated or abnormal. His A1C was elevated and taking multiple medications, about 12. No one had ever sat down with him and explained his labs to him or to his wife. Upon the urging of his wife, he did make an appointment with MedsPLUS. He received a comprehensive medication review with us. Not only did he have diabetes, but he also wore a CGM or continuous glucose monitor, such as the Freestyle or Dexcom. But when he saw the numbers, wasn't quite sure what to do with them, did not know what they meant. Now, this person also had access to his labs from the doctor's office, but did not know what the numbers meant. Didn't know what questions to ask, didn't know what to look for. Was it stable? Was it a trend? Is it progressing in the right direction? Is it progressing in the wrong direction? Is there improvement? More importantly, he didn't know what options he should have been offered or what questions to ask. So once again, upon the urging of his wife, he booked a consultation or comprehensive medication review with MedsPLUS. A couple of facts about our clinical consultation. This is not a 5-minute conversation. This is a structured, paid clinical service. We will review your labs. We will be able to help you to understand what is going on. So what we did specifically for him, we were able to tell him about what stage of kidney disease he was in, if there was, what the cardiovascular risk was for him. Also taking a look at his medications. So when we do a comprehensive medication review, we're looking at your medications based upon your diagnosis. Are these the right medications for that diagnosis that are on par with current treatment guidelines? That's very important. The reason I say that is this person presented with a medication regimen for diabetes, which I actually felt like could have been a little bit better based upon the age and the ability to afford medications, be able to listen, understand, and to take the medications. One question kept coming up as I did my review and as I spoke with him. Why hasn't anyone discussed a GLP-1 medication with you? See, GLP-1 medications are more than just for weight loss. It provides kidney protection, and it also provides stroke prevention. We went through not only the medications for diabetes, but also the medications for resistant hypertension. Normal treatment of hypertension can be 1, 2, or 3 medications. But when we're talking about resistant hypertension, we're looking at upwards of 5 medications. Some of those medications can cause drowsiness. And that was one of the chief complaints that his wife had about his change. He wasn't as quick to respond, or sometimes kind of seemed dazed out, not necessarily confused, but just slow to respond. So we went through all of the medications, talked about his numbers as it relates to his blood sugar readings. And once I saw everything that needed to be seen, I then prepared an appointment guide for him. So see, I didn't call the doctor myself. I was able to arm him with the information or provide the information to have a discussion with the doctor. So Dr. Pauline and I say this all the time. Gone are the days where we go to the doctor and we just nod our head. We should have informed questions ready to have a discussion, a two-way discussion with the doctor, and to make sure that you understand before you leave. So he had an appointment coming up within the next 2 weeks, and it was actually to one of his specialists. So I said, well, do you feel comfortable having this conversation? We went over it. Yes, felt comfortable. So he went to his appointment. I followed up with him the next day. And guess what his specialist asked him? Why hasn't your doctor prescribed a GLP-1? And he said, I saw my pharmacist and she asked the same thing. So he actually walked out of that doctor's appointment with a prescription for a GLP-1. So let me be clear. A comprehensive medication review, or CMR, isn't about replacing physicians. This is about collaboration. This is about asking informed questions. This is about advocating for yourself or for a loved one. Chronic kidney disease and diabetes hits our community harder. We have dialysis centers throughout the neighborhoods. We cannot afford to operate in the dark. A comprehensive medication review can identify gaps in therapy. So what is a gap in therapy? A gap in therapy is one in which was discovered with this CMR, with this gentleman. He was taking 3 different types of insulin, oral medication for diabetes, and multiple medications for hypertension. So as he starts to take the GLP-1, and as I explained, we're going to need to continue to follow up with him because he's going to go through some changes that we need to make sure we monitor him with. So we check in with him at minimum weekly, unless we have to do more. And as I suspected, he began to notice lower blood sugars because now you're on a GLP-1, you're decreasing appetite, you're going to be losing weight, and it's also controlling the blood sugar differently than just taking the insulin. So we're helping him to manage that. But not only that, when you do a CMR and you see that there's more education needed, we were able to set him up with a nutritionist to make sure that he's going to learn how to balance his meals so he's still getting nutrition as that appetite decreases. So during that consultation, we were able to clarify his kidney disease. And yes, I wanted him to understand he has kidney disease. He's not on dialysis, but he's at a stage, if we don't make a turn or correction to help lose weight, get the blood sugar under control, then that is where his chronic disease can progress to. So we're trying to prevent that. So we were able to get an understanding with him of all of his labs, why he was taking the medication, why he was taking it at those doses, because of the risks he had associated with his heart as well as with his kidneys. So we were able to align his treatment with current evidence. So we're not done yet because we want to take things in a stepwise approach. So once those begin to line up the way they should, then we want to be able to start to deprescribe or decrease the dosages of that problematic blood pressure medicine that I spoke about earlier. So we were able to get that understanding so we know what the next step is at the next doctor's appointment, and we continue to have our check-ins. This has allowed him to be able to go armed with information at his appointment, speak up and advocate for himself because the doctor had not mentioned a GLP-1, but just continue the regular therapy that he had been on. And mind you, he had had a previous stroke many years back. But as the evidence changed, the therapies and the guidelines change, then we should be able to have access to those therapies that not just try to control the blood sugar, but also provide a cardio or heart protection and kidney protection that's going to help decrease that progression to kidney disease. This is going to help you increase your confidence in your care at your doctor's appointment. It is a paid service, as I said before, and it may save you thousands of dollars in complications later. Too often, we are treated, but not educated. Comprehensive medication reviews matter, and we want to be able to be your healthcare partner in helping you or a loved one to understand what all of this health information about you means. Education is not optional. Advocacy is not disrespectful. Asking questions is not challenging authority. And prevention is far cheaper than complications. It is protecting your life. And more importantly, it gives you understanding. Because sometimes the difference between progression and prevention is one informed conversation. So you may ask, how do I get that conversation? Well, just check out in the comments below. I have put in a link for you to schedule a clinical consultation with MedsPLUS Consulting. It's very easy. Click on the link, select a date and time. We will do an initial call and let you know what information will be necessary to do the CMR, and then we can get your CMR scheduled and be able to increase your understanding to not only advocate, but to have a better conversation during your doctor's visits. This is Dr. Jennifer with MedsPLUS Consulting, Pharmacy and Wellness Center, and we hope that you have an excellent week.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.